I am back, so let us continue. Indicate if you can hear me clearly.
Yes, we can hear you clearly.
Okay.
JDF class present.
All right. So we have looked at what EMS is like in the States. So we're gonna focus for a short time frame on what it's like being an EMS provider in Jamaica. All right, so a day in the life of an EMS provider. All right, now the objectives. I'm going to define what is an EMS system, list the providers that function within an EMS system, understand the type of care provided by EMS providers, understand what a typical day is like at work for an EMS provider, and look at the challenges of working in an EMS system in Jamaica as well. All right, so I'm going to start off with a little story, true story. All right, so the shift is a 7 p.m. to 7 a.m. shift. So in EMS, we work 12 hours, right? As a paramedic, depending on where you work, you might do 24 hours on, 4 days off, but it's 12-hour shifts, right? Right, so it's a 7 p.m. to 7 a.m. shift. I got to work 30 minutes prior to the shift starting. Within this 30 minutes, sometimes 15 minutes, depending, you will check your ambulance. The ambulance is sometimes referred to as the rig or the box. And of course, we pray to the EMS gods, if it's a busy system, that they show us mercy. If they don't, we're going to get a lot of calls. If they do, might get some free time. All right, so dispatched. 7:05 p.m., first call comes in. A 62-year-old female found unconscious by her husband. So we drive out, lights and sirens, ensuring we do so with regard for public safety. On scene. We arrived on location safely and within 10 minutes. Our scene and patient assessment revealed a diabetic with low blood sugar and bad veins. I am now worried, right? So this patient had terrible veins and she had a discoloration on her leg from a previous intraosseous needle insertion. So I knew that I would have a tough time getting an IV access on this particular patient. Management. Then I remembered I am a well-trained paramedic, so I ensure the patient has an airway, chest movement, and the heart is pumping. Right? Anytime you have a patient in a pre-hospital emergency situation, there are 3 things that will kill your patient very quickly. 1, an airway that's closed. If a patient airway is closed and it's not open, the patient is gonna die, and they can die very quickly. 2, a chest that's not moving. If your patient's chest isn't moving, it means the patient is not ventilating properly. That will kill your patient very fast. 3, a patient that is bleeding excessively. Anytime you assess a patient in a pre-hospital emergency setting, these are the things you must assess and manage first. I hope that registered, right? So it is not do a full set of vital signs, right? Vital signs cannot come before life-saving care. It must be life-saving care, then history, vitals, right? I gave the patient glucagon intramuscular. I eventually found a vein, but when I started to advance the IV catheter into this vein, I hit a valve, right? Now, this lady had terrible veins, so I had to try and get the IV catheter past that valve. So what I did at that point is I then used a flush, right, a 10 mil flush, and I attach it to the end of the IV catheter and squeeze the flush and advance the catheter at the same time. So the flush opened the valve so that the catheter could go into the vein, right? So I was able to get the IV access. I gave the patient dextrose or sugar through her vein. The patient starts to wake up within 3 to 5 minutes. Patient transportation. We then packaged the patient for transport, took her to the most appropriate healthcare facility, and handed her over in a stable condition to the medical staff. Now, when you're handing over a patient, you cannot hand over the patient to someone below your level of training, right? That would be abandonment. So whoever you're handing over the patient to, that person must be at your level of training or higher. Right, so that was my first medical patient as a paramedic. I took the lead and I managed well. Now I clean my unit and restock. And I say to myself, bring on the calls. I am ready, right? Conclusion to the story. I had 6 more emergency calls on that day. Some did not end perfectly, but we learned to do and hope for the best by being disciplined and following protocols. Some people think we just do first aid. Others think we operate a taxi service. Some think we are race car drivers, and others think what we do makes us heroes. What we really do is we provide emergency care to the sick and injured in the field. A badass paramedic approved this, right? So we are EMS providers. Badass is an inside joke. So badass actually means band-aid distribution application system specialist, right? So that's an inside joke. All right. What is an EMS system? Emergency medical services, also known as EMS, is much more than a ride to the hospital. It is a system of coordinated response and emergency medical care involving multiple people and agencies. These agencies are the hospitals. So in Jamaica, we have EMTs working in the hospital. We have EMTs in the police force. We have EMTs in the fire service. We have EMTs in the JDF. We have EMTs that work for private ambulance services in Jamaica, right? The response within an EMS system can either be BLS, which is basic life support, or ALS, which is advanced life support. Currently in Jamaica, no ALS system exists, right? The closest thing to that would be how the medical assistants operate in the JDF, but it's not a regulated system. All right, now EMS providers, EMRs, emergency medical responders, provide field care prior to ambulance arrival. You have your firefighters, police officers, and in the industrial setting, you have safety officers, right? So when I used to work as an industrial responder at WARF, it was APM terminals at the time. I was responsible for training persons on the emergency response team, and some of these persons were safety officers. EMTs, emergency medical technicians, trained to provide field emergency medical care and continuous care during transport on an ambulance. Right? AEMTs, advanced emergency medical technicians, trained to provide certain levels of advanced emergency care in the field and during an ambulance transport. Currently in Jamaica, PHEMS, Hospital Emergency Medical Service Unit, which is a part of the UWI School of Nursing, only offers training in these three areas: EMRs, EMTs, AEMTs. There is a paramedic curriculum that is being developed. It has been passed by, I think, one board, but it is still being developed. It has not been approved as yet, right? The EMR training is about 1 week. It can be 2 weeks. EMTs train full-time for 9 weeks. If it's part-time, they train for 9 months. Sorry, not 9 months, 3 months. Now, based on the DOT curriculum, you're required to have, I think, 130, maybe 150 hours. The course that PHEMS provide double the hours, right? The AEMT training is 3 months full-time. If you're doing it part-time, you're looking at 6 months. All right, now EMS providers continued. You have the paramedic trained to provide all aspects of advanced emergency care in the field and during ambulance transport. Now, the most common level of EMS providers in Jamaica are EMTs, right? So that's the most common level of providers. Now, I mentioned to you previously that there is no regulation for EMS providers in Jamaica, right? There's no accountability. No registry exists, no council exists, right? What that means is a person can be out there working as a EMS responder in Jamaica and their certification has expired or the certification is fake, right? And that is as a result of lack of accountability. A person can be out there in Jamaica and they just buy a bus and they have a contact, and that contact passes the bus as an ambulance and it's operating as an ambulance service, but it does not meet the specifications, right? So without accountability, you have inconsistency. When you have inconsistent approaches to EMS care, the patient suffers, right? That's where a patient is going to suffer. Now, EMTs primarily function on BLS unit and AEMTs and paramedics work on ALS units. However, in the Jamaican setting, I strongly believe that the EMTs that are currently working in the hospital, like St. Anne's Bay and Maypen Hospital that employs EMT, and I think Cornwall Regional as well, I think they should be trained at AEMT levels or higher, right? Based on what they are allowed to do in the hospital, because the EMTs in the hospitals in Jamaica, they're doing ECG, they're doing suturing, they're doing IV access. Some assist with medication, so they should be at the AEMT level, right? So they can be allowed to do these things under direct supervision, but they are not recognized as advanced until they have completed a formal training program, right? I also believe that the EMTs that work in the industrial setting, right, like where I used to work at WAF. Currently, I'm a sessional paramedic at Petrojam. Kingston Freeport Limited also employs EMTs. I think the EMTs within the industrial setting should also be at an advanced level, right? In the industrial setting, emergencies do not occur often, but when they do, they're extremely bad, right? These are not simply emergencies. And I think it would be better if they are at the AEMT level or higher. Within the JDF system, right, based on what you guys are allowed to do as medical assistant, all of the medical assistants should, well, once they have the aptitude, I can't say all, once you have the aptitude for it, I think you guys should be trained at the AEMT level or higher. All right, now emergency care. The level of care provided includes, but is not limited to, 1, airway management. And with airway management, we're talking about upper and lower airway management, right? So you must be able to manage the upper airway, you must be able to manage the lower airway. Bleeding and shock management. So wound management, how to recognize shock, how to treat the patient for shock. You must be able to splint upper and lower extremities if they are fractured or if there is a joint injury, and you must be able to fully immobilize a patient properly on a spine board using a C-collar. That's spinal motion restriction. Medication administration, field management of a critical trauma and medical patient. And I also include basic ECG interpretation and fluid resuscitation, the principles behind fluid resuscitation and drug calculation, right? A lot of the JDF persons that have done the course, a lot of the skills or some of the skills you will be familiar with. What I've observed over the years when it comes to teaching the JDF persons, they know they can do the skill, but they don't know why they're doing the skill and when the skill should be done. And that is important. So you can't know to do something and you don't know why you're doing it, right? Starting an IV is not a big deal, right? Advanced skills are not a big deal, right? It's not important. Well, I shouldn't say it's not important, but it's not something to be praised for. What is important is you know, right? So I can teach anybody to start an IV access. When I can teach somebody to recognize why it is that they're starting that access, how it is that they calculate the fluid to ensure that the patient lungs is not congested, how it is that they calculate the fluid to determine the drip rate, that is more important, right? So the understanding behind the application of the skill is extremely important, and that is what defines an advance between an EMT. That is the difference between an advance and an EMT, right? The understanding, because there are EMTs that can be taught to start IVs, and they are allowed to do IVs in certain states, right? But if you don't have the understanding behind it, right, then you have a problem. And usually these EMTs are EMTs that work alongside paramedics, because my partner was an EMT, right? So I provide the understanding, they can do the skill, right? And there are some patients where my partner might be starting an IV on the left side and I am doing it on the right, because some patients might require 2 IV access, right? But it's based on the instructions that I delegate. So that's very important. Now, the other thing, let me just backtrack a bit where the levels are. Don't be afraid, but I don't even want to say afraid, but your title is important. So if you're an EMT, you're an EMT, right? You're a AMT, you're a AMT. You're higher, you're higher. Don't pretend to be something that you're not. And that is something that is very common in Jamaica. So there are a lot of EMS providers in Jamaica that are walking around and telling persons that they are paramedics. Currently in Jamaica, there are only, well, let me see, there are 3 paramedics in Jamaica that I know of legitimately, right? I am one. The other paramedic is within the fire brigade. He is the superintendent for EMS, and there's another paramedic. He was trained in Canada. He lives in Jamaica, right? He does remote work, so he travel back and forth. That's the only paramedics I know of on the island, right? There are a lot of persons out there saying they're paramedics, and the term medic, when you hear somebody say medic, that's a term that is used in the state. It's a short version of paramedic, right? You're an EMT, you're an EMT. This is very important. Why am I emphasizing this? Because with misinformation, it lowers the respect that is given towards the profession, right? So if I am an EMT and I go out there and I perform poorly, right? And I am telling the persons around me that I am a paramedic. And sometimes you go out there and you perform, doctors and nurses don't say anything at that point, but they are communicating with each other, right? You know what the doctors and nurses are going to say? Doctors and nurses are going to say, you know, I received a patient from a paramedic. The patient was poorly managed. I mean, the paramedic training are nothing important then, right? So that affects how the profession is perceived. On the other hand, or on the other side of that coin, it could be an EMT that did very well. EMT did a great job in stabilizing the patient, but he's telling persons that they're paramedic, he's a paramedic. So the doctor and nurses are saying, well, I came across a paramedic today, did a great job in assessing the patient. It's a pity the EMTs them can do the same. So it affects how the profession is perceived. And there are some EMTs who are out there pretending that they're doctors as well. So respect your title, right? If you want to become a paramedic, work towards it, right? It is not an easy task. It is very difficult to become a paramedic. It's one of the hardest courses I have ever done. I've been in EMS, right? So if you want the title, work towards it. And that's for all of the levels. EMR, EMT, AEMT, paramedic. All of them are important. I don't look down on any of them, right? But you have to start somewhere. All right. Now, a typical day at work for an EMS provider, it involves time management. I keep saying that, right? And to be honest, all of the groups that I've trained at JDF, I never had an issue with time management. The time management for the JDF personnels have always been great, right? So don't have an issue with the JDF where that is concerned. Private candidates, I definitely sometimes have an issue with that, but they tend to learn very fast, right? And if you're not present when I'm teaching, you miss out. And if you miss stuff, you're gonna have to teach yourself, right? And that's not an easy thing to do, especially if you're not disciplined. So time management is important. You need to get to work at least half an hour or 15 minutes before. Where I was working, half an hour, because I had to check my unit, plus I had to sign off for my medication and check my meds, right? Because you have to sign up and collect the control medications as a paramedic. Because the person that's coming off at, so if the shift is 7 p.m. to 7 a.m., that person can get a call at 7 o'clock. And if I am not there, that person has to go on the call, right? And that is somebody that could be very exhausted and might go out there and not perform very well. So you have to consider the persons that we're working with, right? And your time is valuable. Your time is valuable. My time is valuable. So I don't expect you to waste my time. I am not going to waste yours, right? That is my philosophy, right? So waiting preparation, right? Once we have checked the unit, we just relax and we stay prepared, right? Until there's a call. And it depends on the system, right? It might be a system that is very active, so you might get 7 calls most per shift. Might be a system that's not very active. The entire 24 hours, you might get maybe 1 call or none. It depends, right? After you get a call and respond, the rest is straightforward. You have to provide assessment for the patient, appropriate treatment, packaging, and you transport, and you determine if it is emergency transport or not, right? After you transport the patient, you take them to, well, you transport the patient to the most appropriate facility, handover. After you handover, you have to clean your unit, right? So you have to clean up whatever you use, make sure that your unit is ready to go again, right? Now, while en route, you have to call whichever facility you're going to. You have to contact that facility and relay information regarding the patient, right? By the time you get to the receiving facility, majority of your report should be completed, right? So you will give a verbal report. Once you have given your verbal report, then whoever you gave or hand over the patient to need to sign your report, right? Now, the system that I was working with, my cardiac monitor was linked to my laptop or the reporting device that I was using. So whatever information is recorded on my cardiac monitor, it's transferred to my laptop or the device that I was using for my report, and I can send that directly to the hospital that I'm going to. That's how it works in the States. So by the time I get to the hospital, it would have most of the information, right? Now, in Jamaica, we don't have that technology. So you have to write down whistle, as we call it, right? You write down important information. And what I used to do when I was working in the field in Jamaica is I would tear off or cut off a piece of micropore tape and tape it on my leg. And I'll write down important information on it. Sometimes I'll write on the gloves as well, right? And then I put in the important information on my run sheet. So by the time I get to the hospital, the summary is in and the report is pretty much finished. I just need the signature. All right, now challenges in EMS in Jamaica. Poor public awareness and education. Right? So anybody in this group know when EMS started in Jamaica? Raise your hand if you know. Okay. Anybody know how many EMS stations are available across the island within the fire brigade? Okay. Anybody know any private ambulance service that is available across the island? Raise your hand if you know. Okay. I do not do an EMT course. Interesting. All right, so public awareness and education. EMS in Jamaica officially started in the 1990s. I think it was 1995 or 1994, right? And the main reason for that is there was a very bad accident involving a tourist. The tourist died, right? And a lot of finger pointing took place after. And as a result, they had to put something in place, right? The first set of EMS providers in Jamaica were trained within the fire brigade, right? And the pioneer for EMS in Jamaica is Dr. Winsome Degree. She's the reason why today PHEMS exists. She's the reason why PHEMS has EMS programs, right? So the first set of EMTs were in the fire brigade. Most of the EMS stations that are available within the fire brigade are found in tourist areas, right? The Grill, Mobile, I think there is one in Hanover, right? They have an EMS station in Portmore that was recently open, and they have one in Linstead. But the capital city of Jamaica has no EMS response. And if you should do a research, you would discover that majority of the trauma and medical emergencies, or a large amount of the trauma and medical emergencies, occur within Kingston and St. Andrew, right? And I don't understand that logic. You can't have an EMS system and the capital of the country don't have access to it, right? Now, what do we mean by that? The EMS system that exists within the fire brigade, you do not have to pay for it. Well, technically you do, or you don't have to pay for it up front, right? If you're paying tax, you're paying for that service. So all you have to do is call when you need the service, right? That's the EMS response within the file. Now, you have to be specific in how you contact, because Jamaica does not have a dispatch system. If you call 110 for an ambulance, you're gonna get a call center. That's what you're gonna get. And the call center is going to tell you to call the nearest station to you, right? And that is something that needs to be addressed. So you have to know which station as EMS response. And that's one of the reasons why I moved to Portmore, right? Because there is an EMS response system here within the fire. And all of the EMTs that are within that system, I train them. So I can rest easy, right? So that's the history of EMS in Jamaica in a nutshell, right? Now, the question is, why is the system like that? I really don't know, because we have gone over, what, 2 decades, right? We've gone over 2 decades where the EMS system that exists on the island is not regulated, and it is limited and more accessible to tourists that uses the island. But it has become so normalized that nobody cares, right? Because the truth is, once you are paying tax, you're paying for it. You're entitled to it. Yes, Mr. Cameron, go ahead.
Sir, Mr. Shantillo asking a question. Where in Portmore is the EMS service?
Waterford Fire Station.
Recently.
Sorry?
Is it recently, right?
Maybe 2 years ago.
Okay, sir.
Yeah, man. Yes, Miss Lewis. Miss Lewis? Go ahead, Miss Lewis. You have your hands up. Okay. You have a question, Miss Lewis? All right. If you're having connection issues, remember you can type the question in the chat, right? All right, so type your question, Miss Lewis, or whatever it is that you want. Right. Yes, so EMS was established in Jamaica because a tourist died. It has nothing to do with Jamaicans dying. There is no EMS response within the fire service in Ochi, but they are going to open up a EMS station in Ochi and I think Sentance Bay within the fire. There are private EMS companies in Ochi though, right? And I think, yes, there are EMS response within the fire in Mobi as well. All right. What was I about to say? Right. Now, there are private companies, but I don't want to bash these private companies. I don't trust, well, I don't want to say I don't trust. I'm not comfortable using private services for EMS response in Jamaica. One, you have to pay for it, right? So you have to pay for it. Two, I don't have evidence to support that the private services are ensuring that their EMS providers are up to date. I don't have evidence to support that, right? I can only there's one for sure that I know ensure that their EMTs are current and go through recertification. So I'm not gonna call a private service, and I cannot determine if the EMS providers within that service are up to date, because if they're not, I'm going to sue the company, right? That's negligence, right? So I'm not an advocate for that. And usually most private services focus more on making money and less on patient care. With the fire, I know for sure that the fire service tries to ensure that their EMTs are recertified, right? They really put out the effort for that. So, and right, so I would be more comfortable using the fire service. Where the JDF is concerned, I mean, the JDF system is kind of more specific to the JDF soldiers, right? I don't think the public benefits largely from what exists in the JDF. It's more specific to the soldiers. The JDF needs to be consistent, right? So the initial training that you will receive as an EMT will last for 2 years. After 2 years, it expires. You need to be current, right? Or you need to recertify if you're going to function as an EMT. You're gonna be functioning as something else, that's fine. But if you're going to carry out functions as an EMT, you need to recertify. If you have not done so, then grounds for negligence exists. You have to be careful of that, right? So consistency is important. I'll overemphasize that. Anyway, right now, that is the current state of EMS in Jamaica. With the existence of social media, a lot of things are changing, right? Because gone are the days where we can go there and mess up and nobody really knows, right? Nobody really knows. But now, every accident scene, every situation, there's a person with a smartphone, right? To capture what is going on. I think it was a couple months ago, I got a video with an accident involving a JDF personnel, right? So people are capturing what we're doing, and when it enters or is uploaded onto social media, people start to ask questions. Why is this happening? Why is this not being done? So questions are being asked now, right? So it's not gonna be as it was back in the days. Changes have to be made, right? And as much as the fire brigade doesn't have a lot of EMS station available, I see where they're making the effort to expand that, right? I think we need to put more funding in the EMS section, and I strongly believe that Kingston and St. Andrews should have an EMS station, but we'll see what happens, right? But there are changes going on. The JDF has been consistently sending persons to be trained as well, so that's good, right? Knowledge is power, right? And share the knowledge, educate persons within your community, let them understand what should be happening and what should be expected, right? And I've started to see the difference because I've seen a lot of videos over the years, right? I've seen videos where persons took people out of vehicle and the person drop out of them hand. Car accident, right? They took the person out, the person drop out of them hand when them take out the person. That's bad. But I've also, over the years, seen videos where persons are now telling persons, don't get up, lie down on the ground, right? The ambulance are come, right? I've seen videos where where civilians took the person and put the person on a board, flat, and transported the person in a van. So people are becoming aware of what is needed, right? And one of the things that I am focusing on for my graduate studies is EMS research, because there's not a lot of EMS research in Jamaica. So definitely for my thesis, I want to do something in EMS research, and that's going to drive changes in EMS. So when you can produce evidence that cannot be disputed based on research finding, then we have to think about change, especially if it's costing a lot of money, right? So the future of EMS in Jamaica doesn't look too bad, right? But my time is coming to an end, and hopefully I'll find my successors. But definitely I'll be focusing on EMS research as I go forward. All right, now summary. EMS is essential to pre-hospital field care. There are BLS and ALS providers within an EMS system. However, in Jamaica, only BLS exists, right? Matter of fact, majority of the AETs that I've trained are outside of Jamaica. They don't stay in Jamaica, right? Mr. Powell is in Turks and Caicos. There was a lady that I trained, she's in Antigua. She completed her nursing. Another AEMT that I trained is in the States. He became a army medic. So majority of them move on to jobs outside of Jamaica, right? I do believe that they can be incorporated into what exists in Jamaica, especially with the whole COVID situation now, where there is a high demand for healthcare providers. I think the AEMTs would fit very well into that system, right? But I don't have that type of power. A day in the life of an EMS provider is very dynamic and long, but can be very exciting and memorable, right? So there are definitely some calls that I will never forget, right? Good and bad calls, right? That have shaped the type of provider I became over the years. There are major challenges that exist in EMS in Jamaica. And one of the primary problems in Jamaica is public education, right? Because anytime anybody tries to bring EMS to the forefront in Jamaica, it is brushed aside, right? Or quickly removed from the media. Many years ago when Dominic was the young man that was that died at George's, right? Collapsed on the field. When he collapsed and died, there was a primary article that came out. I think it was in the Gleaner. I don't remember if it was the Gleaner or the Star, but there was an article that came out and stated that initially that no doctors were present, only 2 nurses. And then a second article came out and stated that there was a doctor, I think either 1 or 2 doctors. And the doctor stated that the young man collapsed started to have a seizure, and he didn't have oxygen for the patient, so he handed over the patient to his father, and the father transported him to the hospital. Now, after that article came out regarding what the doctor said, nobody said anything else after that. And that's a huge red flag. That is a huge red flag. No doctor is going to hand over a patient to a family member. That's negligence. You have handed over the patient to somebody below your level of training. By law, once there is an emergency and you go there and identify yourself as a doctor and start to care, you must continue care until the patient is handed over to someone at your level or higher. So something was very wrong with that statement. 2, oxygen does not stop seizures, right? So oxygen is not going to stop a seizure. It's either the seizure stop on its own, or you have to give them a benzo, right? A benzodiazepine to stop the seizure. So there were 2 things that were very wrong with that statement. But because the title was there, doctor, okay, that's good enough for me, right? And titles mean nothing, right? You can have 10 titles before your name and it means absolutely nothing because you don't know the work, right, that support your titles. So it doesn't make sense if you have a title and you don't know what you're doing, right? Titles are not important. Let your work speak for you, right? Anyway, so after that, people were still questioning why EMS is not there and stuff like that. And I think it was Dr. Orville Taylor that wrote an article in the Sunday Gleaner. And in that article, he was basically saying that whatever the doctor said is good enough for him if the doctor said it. And if EMS was that important, his daughters didn't need to go to university and obtain degrees in whatever field they're in, right? So he was very disrespectful to the profession. I saw the article and I decided that I'm going to respond to Mr. Taylor's article and I'm going to copy the Gleaner. Anyway, I wrote an article, and basically what the article was about is, in the article I was saying to Mr. Taylor in a nutshell, if you do not know about a profession, then you should not be speaking about the profession. And I went through the various levels of EMS responders, and I focused on the paramedic and said, if a paramedic was present, a paramedic could do every single thing that the doctor would do in the hospital right there for the patient, right? Everything. The patient needed advanced airway management, paramedic could do it. Patient needed meds, paramedic could give it either IM or IV or IO, right? So everything, they could have done it. And in a nutshell, the most important points of the article that I wrote was, I wasn't saying to them that we need to have an ambulance at every football match, right? I said, as a third world country, Jamaica can't afford to do that right now. But what Jamaica can afford to do is train the teachers, the coaches, right? Teachers and coaches as EMRs. Give them a jump back. If something happen, they can provide initial care until an ambulance response is available, right? Now, I said in ending that article that I don't know if a proper EMS response was available, Dominic would have survived. But I think Dominic deserves that as a Jamaican, right? So as a Jamaican citizen, he deserved the best response possible, and he didn't get it. Now, after I wrote that article to the Gleaner put out the article as the letter of the day, but they took out everything that I said about EMS. Everything that I said about EMS was removed. Even changed the heading of my article and said, I was saying that first aid would have made a difference, right? So they removed everything that I mentioned regarding EMS. And this was done to, I don't know, to this day I'm still not sure why. Well, I have an idea, but I'm not gonna say it in this medium, right? So when it comes to EMS, the government of Jamaica knows what is required. They know, because if they have ambassadors for large events taking place, they are going to have EMS responders there. And the question is this: why is it that the government see EMS response as something important, but doesn't see it as something that needs to be regulated? So why am I as a government going to request EMS response? And the EMTs that I am requesting, I don't know if they are certified or up to date. It doesn't make sense to me. But maybe I will figure it out down the line, right? So that is the current nature or system that exists in Jamaica. Any questions? Ms. Lewis, any thoughts? Okay. Cameron, Mr. Cameron, any thoughts? Go ahead.
Yes, sir. Shantelope again.
Mhm.
Yes, sir. How is this equivalent to a registered nurse or practical nurse?
Or is it equivalent?
Yes, the EMT.
Okay.
Is there any
All right.
comparison?
I don't like when people ask me that question, but I'll try and answer. Um, um, a practical nurse is not regulated, right? So the training for practical nursing varies depending on which institution you go to. A practical nurse would be below EMT as it relates to a registered nurse. A registered nurse is at a higher level than a EMT, right? But as I say, there shouldn't be a comparison because the skill that the EMT is trained in is specialized, right? You're trained as a specialist. In other words, what you are trained to do as a pre-hospital provider, a registered nurse cannot do the same. They're not trained to do that. So it's two different spectrums. But if you look at the qualification and the time period of training, then the RN would be above the EMT. In terms of the AEMT, the same thing, because the registered nurse trained for a longer time frame. As it relates to the paramedic, there is no difference really, right? There's no difference. And I would give the paramedic the edge. Now, again, there shouldn't be a comparison. A paramedic can train for 1 year, 2 years, 3 years, or 4 years, right? Nurse, you can have an enrolled nurse that is trained for 1 year, and have a RN that's trained for 2 in the States, and you can have a RN that has a 4-year training. Now, whether it's a RN or a paramedic, regardless of the length of training, within the first 2 years of your training, you learn everything that you're supposed to know in terms of field care, right? The first 2 years. The additional training that you receive as it relates to paramedicine is for if you want to move into a different career afterwards, so you can use it as credit, right? So you can use a paramedic degree and do a bridge nursing program where you become a paramedic RN. Most of the flight medics are paramedic nurses. There are a lot of paramedics, when they get tired of the field care, they go into the hospital setting as emergency nurses. You can use a paramedic degree to go into med school. You can use the paramedic degree for graduate studies, as I am now doing. So at the paramedic level, I don't really see a difference. I don't see a difference because I don't need the doctor right there in the field to tell me what to do. I can do what I need to do based on my protocols. The nurses must get instruction from the doctor, right? So that's the difference. But as I said, I don't like the comparison. Both of them important. But I hope I answered the question.
I just clarity boss.
Yeah, I get it. Let me see what Miss Lewis have. Okay. Yes, that's quite possible, right? So if there is no regulation, and only the government can regulate a EMS system, right? If there's no regulation, it's quite possible that persons are working with a certificate that has expired, are working and they're not trained, right? That can happen because there's no accountability. And if you are going to contact a private service, 2 things you need to ask right off the bat. Does your service have a medical director? If yes, can I speak? If I need to speak to the medical director, is that possible? So if you're using a private service or any service, you shouldn't have trouble communicating with the medical director for that service. 2, that ambulance should not be responding without an AED. If they don't have an AED on board, they shouldn't be responding. Yes, Mr. Wilson.
Yes, sir. So, little career advice. If I was taking the route, I say, all right, I do EMT, you know, more
Yes.
go further.
Uh-huh.
Is it a case where it'll be better if you go paramedic or go RN, in your opinion?
I would go paramedic. Why would you want to go RN?
Because, sir, remember I did say it's not exactly accessible here. It's kind of easier if you go RN. Because we don't have a set program yet.
Okay. But I don't understand that justification. Is it that you prefer the field of registered nursing more than pre-hospital care?
Sure, I prefer the paramedic, you know.
You need to go with what you prefer, right? So remember what I said from the very first slide. Well, not the very first slide, but the first chapter that I went through. There's a difference between a career and a job. So you can excel in EMS, right? You can excel. Let me turn off the video a little bit. I don't want that